Chapter 8, Part 2, The Moral Politician. How to pass a mandatory vaccination law in your state. Members of the committee, colleagues, and the people of this great state, I bring before you a petition of great importance. We have a health crisis on our hands, one that threatens the lives and well-being of our most precious citizens, our children. Our nation faces disease outbreaks we haven't faced in decades, and it is due to the negligence of only a minority of our people. Despite the overwhelming evidence that vaccines are safe and effective, some parents still do not choose to vaccinate their children. Yet these kids, who can carry infectious and contagious diseases, are given the same rights and freedoms as healthy children who do take part in the vaccination program. Children who not only are vaccinated for their own good, but for the good of society. It's time that we, the legislators who are responsible for the well-being of all our citizens, take matters into our own hands and enact legislation that will protect all of us. Tom Landon looked around at the audience in the hearing chamber. There were seats for 300, but only about 20 of them were filled with staffers from various offices. No legislators, of course. They would have to sit through the real hearing in a few weeks, and no one in their right mind would want to also sit through this practice hearing. But Tom's boss, Charlene, needed the practice, and a junior staffer, Emilio, he thought, from Corson's office, was going to play the role of the opposition and challenge her with some tough questions. This would be interesting. So far, so good, he thought. Charlene was managing to appear as if she wasn't reading her presentation, which was important in order to show she understood and believed everything she was standing for. It had to come across as authentic and original, and nothing put legislators to sleep like someone reading a prepared statement to them. Let me first start with the crisis, Charlene Emerson continued. Measles is at an all-time high, and it continues to rise. This serious, potentially fatal disease was declared eliminated in 2000. But in recent years, we have been plagued by outbreaks. In 2012, we only had 50 cases nationwide. By 2014, that had jumped to 667. And now we have almost 70 cases in one state alone, Minnesota. And our state has not gone untouched. Measles is deadly, and those who do survive it don't go unscathed. 30% of victims suffer complications, and 25% get hospitalized. And it spreads so easily that one person can expose an entire school just by walking through it. And that's just the United States. Measles kills over 100,000 children every year worldwide. To allow this disease to take hold again is unconscionable, and we have the authority to stop it. But that's not the only crisis. Whooping cough is also at an all-time high, and infants in their first year of life are the most vulnerable. Every year, about 20 American babies die from this disease. Whooping cough was nearly eliminated decades ago, but we now have as many as 50,000 cases reported annually. This highly contagious disease spreads easily through childcare centers and preschools, putting infants and young children in harm's way. These disease outbreaks happen because of unvaccinated children. What's alarming to me is that some schools have as many as 25% of their student population who aren't fully up to date on their immunizations. This puts other students at significant risk. But I also want to focus on the kids who are the most vulnerable, immunocompromised children. Children with cancer who are on chemotherapy must also attend school. So do children with HIV. Some kids with chronic medical problems must take medications that suppress their immune systems, leaving them vulnerable. So diseases that might not harm a healthy child can kill an immunocompromised one. You will meet Little Red today, and his father will share their story about how they had to live in fear when a case of measles was reported in their county last year. You will also hear today from Dr. Sampson from the university about how safe vaccines are. The FDA and the CDC, as well as countless medical schools around the world, have been studying vaccine safety for decades, and the science is clear. Vaccines are safe. Vaccines don't cause autism. The one research study that claimed there was a problem years ago was debunked and retracted. And the British doctor who published that false study lost his medical license for committing this fraud. Yet some parents still listen to him and to a few other rogue doctors and celebrities who claim vaccines are dangerous. They are not. They are safe. The government and the courts have the authority and the right to protect their citizens from the threat of infectious diseases. Jacobson versus Massachusetts in 1905 set this precedent in the Supreme Court, which ruled that one man did not have the right to refuse the smallpox vaccination for his children during a smallpox outbreak. The state of California took this step 2 years ago to ensure every school child was fully immunized and protected so that children would no longer be put at risk. And last year, another state made the same decision. Now it is our turn here in our state to protect our kids. I ask for your support to help end this health crisis and save our children. Thank you. Tom stood up and stepped over to the lectern, turning off the mic so he could confer with the senator. Excellent, Senator Emerson. And this would be where you introduce Red and his dad. He's been given 2 minutes to share their experience. Although I sure wish we could have found an immunocompromised child who actually was exposed to measles instead of just one who could have been. Of course, but no one around here has for a while. So we go with what we've got. Mr. Jones said presenting a live face to the members of the committee was key. And then I introduced Dr. Sampson, and he will present his vaccine safety facts. 2 minutes as well. Then I'll wrap it up with the closing we've prepared. Yes, and now I want to introduce you to Emilio Sanchez from Corson's office. Emilio? The young Hispanic man got up from his seat at the table next to the lectern and introduced himself. Don't go easy on me, Mr. Sanchez, smiled Charlene. Bring it on. I will need to be prepared to counter anything that the anti-vaxxers throw at me in a few weeks. Fair enough, Senator Emerson. I've done my homework on this, and I think I have a good handle on what the opposition will say. Just do me a favor. Don't shoot the messenger. The three laughed quietly, 2 of them genuinely. Tom and Charlene sat down as Emilio stepped up to the lectern and reached down to push the button to turn on the mic. Elena Moretti thought Tom's boss had done a decent job. He'd obviously prepped her well, although why on earth they insisted on starting so early this morning was beyond her. 9 a.m.? The West Coast is just waking up, for God's sake. She scrolled through her list of emails on her phone and saw she'd gotten one late last night from Mr. Jones. I'll look at that later. He's probably thought of a new pillar of brilliance or something, she smiled at herself. Then her phone buzzed with a text message. Jackson Jones again. Need to speak with you. Urgent. Call me. Well, yeah, I'm a bit busy right now, she thought. Elena had considered telling the lobbyist about their practice debate and asking him to look over Charlene's presentation to see if he had any suggestions, but figured he was too busy. And that's what the training weekend had been for anyway. We don't need him to hold our hands. She decided to ignore the text for now. She'd share the good news about the success of the practice debate after they were all done. Members of the committee, I am speaking today in opposition of Proposal 999. Exercising our governmental police powers by requiring vaccinations for all school children in our state is problematic for 3 reasons. 1, it is unnecessary, as there is no health emergency, as my respected colleague would have you believe. 2, it won't work, as most vaccines don't prevent the spread of the diseases. And 3, we don't know, scientifically speaking, that the full vaccine schedule which we propose to enforce is actually proven to be safe. Given what Senator Emerson just told you, you are probably thinking I am crazy. But I will show you CDC data that prove I am correct in all 3 of these reasons. Bear with me. First, this law is unnecessary. There is no increase in infectious diseases in our state, and there is no overall increase in our country either. There is no health crisis. Therefore, there is no reason to act with police powers by mandating medical intervention. Allow me to elaborate. Tom was getting a little nervous. He heard one of the legislator entrance doors open behind the raised section of desks where all the committee members usually sat, currently empty during this practice debate, and saw a senator enter and sit down facing the proceedings. That's odd. What is the senator from Orange County doing here? Tom turned around to see the staffers sitting in the audience seat. Most of them were busy texting, and a couple were speaking very quietly into their phones, all except for the staffer from the Orange County office, who was nodding her head at her boss and pointing towards Emilio. Did that staffer call her boss to come in and watch? Let's start with the supposed measles epidemic that Senator Emerson is warning us about. According to the State Department of Health, our state has been virtually measles-free for over a decade. Between 2006 and 2010, we had between 1 and 3 cases every year. In 2011, we had a larger outbreak of 7 cases, but this has not happened again since that time. In 2014, we had 2 cases, one of which was fully vaccinated. In 2015, our one and only case was also in a vaccinated child. We even had 0 cases in 2012 and 2013. Now let's talk nationally. CDC data from the past 20 years show us that we have had an average of 128 cases each year nationwide. And contrary to what my esteemed colleague says, and with all due respect, measles was never eliminated from the United States. In the year 2000, when the senator claims it was eliminated, the CDC reported 85 cases that year. And since then, we have never had a 0 year. So, to state that measles was eliminated and now it's back is not a true statement. That's because the CDC defines an eliminated disease as one that no longer persists continuously in our country, a disease that only exists in small, isolated outbreaks that are quickly contained and don't spread unabated. For example, chickenpox is present somewhere in our country each and every day, and it spreads every day. It's not eliminated, obviously. Measles is, quotes, eliminated because it does not have a continuous presence here, but it was never gone, and it's not back because the CDC still considers measles to be eliminated here in the U.S. by their definition. And this ongoing eliminated status highlights the truth that it is not a rising threat in our country. Measles is not on the rise. Annual cases have ranged from 55 in a low year to 220 in a higher year. In 2014, we had an anomaly, 2 large outbreaks, one in an unvaccinated Amish community in Ohio of almost 400 cases, and another in Texas of over 100 cases, brought our nationwide total to 667 that year. But what is very telling from these 2 outbreaks is that they were isolated and quickly contained. Yes, partly because those outside their communities were vaccinated, but even more so because of our effective public health quarantine measures, which worked like they always have, and voluntary vaccination for those who were exposed. And the total number of measles cases nationwide outside of those 2 areas was just like any other year. The very next year, measles was back down to 188, even with the Disneyland outbreak. And in 2016, we only had 86 cases and 118 just last year. My point is that measles was never gone, and it's not on the rise. Measles is simply measles, as it has been for decades now. Furthermore, measles is not a deadly disease that kills indiscriminately. In all of these outbreaks that we have every year, we've only seen 2 fatalities in almost 20 years. One adult in 2015, who had already been hospitalized for many months for a chronic, unrelated severe illness, was found to have evidence of measles in her lungs on autopsy, although the infection was never identified during her hospital stay. The only other case, and yes, both of these cases are tragic, as all deaths are, was a child in 2003 who passed away from measles complications. This is not a deadly epidemic that warrants extreme police medical powers be exercised now. In fact, CDC data tell us that back when everyone used to catch measles here in our country, back when it was considered a routine childhood illness like chickenpox, the fatality rate was 1 in 10,000 cases. So even an outbreak much larger than any we have seen here in the US in over 20 years is not likely to cause any real harm. Allow me to pause for a moment and address what I know you are all thinking right now. The reason we are all safe from measles is because of the vaccine. And I'm not arguing against that because I agree with you. And I'm not asking you to discount this one particular vaccine or its benefits. And that's a common strategy employed by those who propose mandatory vaccine laws, to paint anyone who argues against such a law as being anti-vaccine, so that you won't listen to anything else they say. Well, I am not arguing against the vaccine at all. I am showing you, legally and scientifically, why we don't need to make vaccines mandatory for school attendance. That is all. The debate over vaccines in general is a completely separate one, and isn't even on the table here as far as I'm concerned. It's only about whether or not we should employ police powers and make them mandatory for school attendance. By now, 5 more senators had taken seats up front to listen in, and 3 more were sitting in the audience. And they weren't busy reading other materials in front of them or speaking quietly with their staffers and each other as they usually did during real hearings. They were actually listening. Tom wrote down the names of those he recognized. They might need some significant deprogramming after this. Okay, moving on to the second disease that the honored senator describes as a nationwide and state health emergency that warrants mandatory vaccination, whooping cough, otherwise known as pertussis. Now, I would agree that whooping cough is a national problem. It can be a very severe disease for newborn babies. We do tragically have about 20 young infant fatalities every year in this country, and we do have more whooping cough now than we did decades ago. Those facts are scientifically irrefutable. But this particular disease and vaccine pair highlights my second point. Mandatory vaccination laws won't work. There is a misconception that all vaccines do 2 things: protect individuals from getting sick and prevent individuals from passing the infection on to others. All vaccines help with the first statement, but most of them don't actually keep the person from acquiring the germs and then passing them on to others. So most of us benefit from getting a vaccine in that if we are later exposed to the germ, we won't feel as sick and possibly won't feel sick at all. That is an individual benefit to that one person. But many injected vaccines only give us immunity in our bloodstream. The infectious germs will still enter our GI or respiratory tracts, multiply in the body, and then pass on to others, even if we don't have symptoms. In other words, a vaccinated person will still be contagious. This is true of our current polio vaccine, the diphtheria, tetanus, pertussis vaccine, the flu vaccine, and others. Therefore, such vaccines offer no public health benefit, and mandating them in school won't change anything. And the whooping cough or pertussis vaccine is a particular case in point, and it's worth focusing on because this is a disease that we are having problems with, as both of us have already stated. But what is scientifically irrefutable is that the whooping cough vaccine does not reduce whooping cough cases. It does not prevent the infection, and it does not prevent someone who has it from passing it on to others. Our own FDA did a study in 2013 which clearly demonstrated that the vaccine only reduces the severity of symptoms in those who catch the infection, but they still get sick, stay contagious to others just as long, and pass the infection on to others just as easily as those who are not vaccinated. Furthermore, those who are not vaccinated and catch the disease develop better and longer immunity and don't get sick a second time compared to those who are vaccinated. And I quote, "The observation that the vaccine fails to prevent colonization or transmission provides a plausible explanation for the resurgence of pertussis and suggests that optimal control of pertussis will require the development of improved vaccines." This is from researchers at our own FDA, and the CDC agrees. The pertussis FAQs on their website state that pertussis is increasing due to increased awareness, surveillance, and reporting of the disease, improved testing, more circulation of the bacteria, waning immunity, and genetic mutations in the germ that help it resist the vaccine. The CDC also says unvaccinated children are not the driving force behind the large-scale outbreaks. And other researchers share their concern. Study after study, which I have provided to you in your information packets, make it clear that our current vaccine doesn't prevent the disease or reduce outbreaks. And I quote from Clinical Infectious Diseases 2012 in a study done at Kaiser Permanente, "The current schedule of pertussis vaccine doses is insufficient to prevent outbreaks of pertussis. The vaccine effectiveness was only 41% for kids ages 2 to 7, 24% for ages 8 to 12, and 79% for teens." And in another study from the AAP in 2015, quote, "This teen vaccine protection from the 12-year-old booster shot wears down to only 34% effectiveness within 2 to 4 years." And keep in mind that what they mean by effective is simply a reduction in disease symptoms, not actual prevention of the spread of infection. In 2014, California had an increase in pertussis, and the California Department of Health tracked all pertussis cases in schools and found that out of the 9,000 kids who caught it, 90% of them were vaccinated. How are we doing here in our state? Well, our whooping cough rate is way below the national average. The CDC pertussis surveillance data show the U.S. national average rate is 10 cases per 100,000 people. In 2012, our state's rate was 7 per 100,000 people. In 2015, it had dropped down to 4. In 2016, it was 6. And just like in California, most of our cases are in vaccinated children. Whooping cough continues to wax and wane, and the vaccine doesn't impact this at all. The fact is, this particular vaccine only helps protect each person from severe symptoms, but it doesn't stop them from catching and spreading the disease, so there's no public health benefit. Vaccination rates in a school won't impact its spread, so there's no group benefit from mandating vaccination against this disease. The disease does and will spread even through a fully vaccinated school. And when it does spread through school-aged children, it's not deadly. It's only dangerous if a newborn sibling catches it, something that vaccination status in the school-aged child doesn't prevent. Therefore, we can talk about our nation's and states' problems with whooping cough all day and how important that vaccine may be for parents to consider with their doctors for their individual children, but that won't change the fact that vaccination status in schools won't change a thing. A law which makes this vaccine mandatory for school won't do anything to reduce whooping cough at all. And ladies and gentlemen of this committee, with all due respect to your service and position, if you don't question Senator Emerson about this and demand a satisfactory answer as to why she is proposing to mandate a vaccine that won't reduce a disease, then you aren't doing your jobs. Again, with all due respect, because none of you asked this very question to another senator who got a similar law passed that mandated flu shots and whooping cough vaccine for all daycare and preschool workers and parent volunteers in preschools. That's right. Several years ago, this very body of lawmakers mandated 2 vaccines for parent volunteers, moms and dads who just wanted to help out and be a part of their preschoolers' lives. You mandated 2 vaccines that don't even prevent disease spread. So now, parents who don't want a flu shot and don't want another pertussis shot can't step foot into their kids' classrooms anymore because none of you thought to ask if the flu shot and pertussis vaccine would even stop these parents from bringing the flu and pertussis into the classrooms. I would like to pose a question and offer an answer I know all of you will agree with. What is the duty of our legislature when it comes to enacting laws to safeguard the public health? One essential requirement for any law that infringes directly on the rights of a portion of our citizenry, even to the benefit of a larger part of the citizenry, is that the status quo isn't working, that the laws and procedures currently in place are ineffective, and there is a clear and present danger to our citizens. If, on the other hand, the status quo is working and there is no danger, then it is our duty as elected officials not to overstep our bounds and enact any extreme measures upon those who have elected us. And in the event of a health crisis, if one should present itself, it is in our own state constitution that when it comes to exercising police powers, we must do so using the least restrictive means necessary to keep our citizens safe. And a law which basically mandates that unvaccinated children must stay home, a law which essentially labels children whose parents embrace a more natural approach to their medical care as unclean, unsafe, and unsuited to be allowed in public, as if we were saying, what, they have cooties or something? Such a law is a most restrictive and inappropriate use of our police powers. We as a nation have done that before to small proportions of our people for unfair and unjust reasons, as other nations have done in centuries past, and some still do today. The status quo of voluntary immunization, which most people take advantage of, and proper quarantine measures enacted by our medical professionals and public health officials have helped keep measles and all other diseases at an all-time low in our state. And again, in order to pass a law, there must be something wrong with the status quo. There must be a problem, and there isn't. Furthermore, for a government to step in with what is essentially an exercise of police powers for the safety of the citizenry, there must be an emergency. And there isn't. Not to mention the fact that stepping in this way won't even work for most vaccines. It's not enough to simply believe vaccines are good, so we need to mandate them. There needs to be a reason. And this brings me to my third point as to why this legislature should not support this bill. If it isn't enough for you to consider that mandating the CDC vaccine schedule is unnecessary, and that it won't even succeed in reducing diseases in schools, the fact that the CDC schedule of vaccines has not been proven to be safe and will harm some children should matter to you. Now, before you accuse me of saying vaccines are unsafe, allow me to clarify exactly what I just said. I didn't say vaccines are unsafe. I said that the current CDC schedule of vaccines, which the bill will require you to mandate, has not been proven to be safe. The Institute of Medicine, which is our nation's most authoritative and respected body of researchers, reviewed all available safety data on the CDC schedule of vaccines in 2013. They concluded that the CDC schedule of vaccines has not been proven to be safe. Here are some key quotes from their conclusions. Studies designed to examine the long-term effects of the cumulative number of vaccines have not been conducted. Existing research has not been designed to test the entire immunization schedule. The committee generally found a paucity of information that addressed the risk of adverse events in association with the complete recommended immunization schedule. I have given you each the entire IOM 2013 report so your staff can verify this information. But I know what you are thinking. We hear it all the time in the news. Vaccines are safe and effective. Vaccines save lives. We know they are safe. The science is settled. But what does that mean? It means that individually, and in some combinations, vaccines have passed the safety testing process in our FDA and have been found to be safe enough for use in our country. Like all medications and medical devices, vaccines do undergo rigorous safety testing individually before they are approved, and the IOM findings support this. And the IOM is not saying that individually vaccines are dangerous. What the IOM is saying is two things. One, we don't have studies that show giving all 70 doses on our CDC childhood vaccine schedule is safe. And two, we don't have studies that have even looked at the CDC schedule at all. Quote, these studies have not been conducted. They haven't studied the long-term effects, and they haven't studied the risk of adverse events from the complete schedule. The IOM actually says one more thing. They also say they recommend the CDC schedule anyway. Don't worry that we don't know it's safe. Do it anyway. That last is not a quote, just my opinion. So, you can say vaccines are safe all day long, and you can believe it. But there is not a single scientist in the world that can show you a study that demonstrates the CDC schedule of vaccines is safe. To support the FDA's safety approval for individual vaccines is one thing, but to legally mandate the CDC schedule is completely different. This legislative body has an opportunity to send a very clear message to its citizens and our federal government that we hold ourselves and our federal medical policymakers to the highest standards of scientific integrity, and that a complex medical intervention that involves injecting every child with 70 doses throughout their childhood cannot, by any reasonable ethical, moral, or medical standard, be mandated without safety testing. It is for these reasons that I and my colleagues oppose this unnecessary bill. Thank you, ladies and gentlemen, and I look forward to your questions. Tom Landon couldn't remember a time when the silence in this council chamber had ever been so loud before. He had stopped turning around to count the number of staffers and senators, not to mention the dozen or so members of the House that had flooded in over the last 10 minutes. He could feel them all staring silently. Even his boss was frozen. Tom knew he had to do something, anything. He stood up and stepped over to the microphone. Thank you, Mr. Sanchez, for that interesting analysis. You have raised a few points that warrant looking into. This was very helpful, and now we have a better understanding of how the anti-vaccine activists may try to plant misinformation into our ranks. And thank you, Senator Emerson, for presenting this important life-saving bill in this practice session. Let's adjourn back to our offices and prepare to move forward. At least this disaster was just practice, so it wasn't recorded like all the regular sessions were, Tom mused, trying to keep an unconcerned look on his face. Many of these people didn't hear most of the first part, and that last garbage about safety was total bullcrap. But Emilio presented it as believable. We will definitely have to do some damage control on that. Terry Wong was usually bored to near death during most legislative sessions. All he had to do was push record when they started and stop when they ended, and check the sound level from time to time. He'd been surprised when Emilio had asked him to record this practice session, something that usually wasn't done. But $100 was $100, and Emilio was a straight-up, down-to-earth guy. He'd talked to Terry on several occasions in the past and treated him as an equal, not like most of the other staffers. To them, Terry was just the nerdy Asian tech guy who sat in the booth all day, so he probably would have done Emilio the solid even for free. And seeing what Emilio just pulled off, and pulled off so well, was worth every penny. Terry didn't really care one way or the other about vaccines. He didn't have kids, and he didn't remember having any bad side effects as a kid, but sticking it to the man was always fun. And doing so on film was even better, something that Terry was very good at. He popped the flash drive out of the computer and slipped it into the inside pocket of his blazer. He thought about deleting the footage from the hard drive, but then realized that he had to pretend as if he'd thought this was a regular session that he was supposed to record. So he clicked the Publish button so it would go live on the state government website. He'd play dumb when someone asked. He was just doing his job, recording everything that happened in that chamber as he always did. They'd delete it then, of course, possibly after all the legislators had viewed it, which was what he assumed Emilio wanted. When that happened, Terry would surprise Emilio with the copy that he could then continue to distribute if needed. Maybe they'd laugh about it over beers or something as Terry consoled the staffer for losing his job. Yeah, there's no way Emilio was keeping his job after this, no matter how innocently he tried to pretend he was just playing devil's advocate. Smart guy, yet naive. Oh well, at least this would be the most fun I've had in a while. The three staffers cringed as they heard the high-pitched yelling coming from Senator Corson's office. Fortunately, most of it was muted by the thick door. Two of the staffers glared at the third, who tried his best to look innocent and neutral. Several minutes of muted discussion followed, then Corson's door flew open, and Charlene Emerson stormed past, snapping her fingers for Tom to join her. Tom looked back at Elena as he followed his boss out through the front office and made a call me motion with his hand. Elena Moretti stood up and strode toward James's office. Emilio started to follow her in, but Elena stopped him. You might as well start clearing out your desk, Mr. Sanchez. I'll let you know if Senator Corson wants any final words with you. Elena closed the door behind her and approached the senator's desk. James was standing behind it, looking out the window. He knows he's fired, right? Yes, sir, although I'm going to see if he'll agree to a resignation instead. Less paperwork and fewer potential legal issues. We can't technically fire him for being good at his job. Where the hell did he get all that information? He has obviously been working on that for weeks, and to present it all in front of other senators, staff, and even some representatives, and in such a well-resourced way, we'll have a hell of a time bringing enough people back onto our side. We had this bill in our pocket. We had all the votes we needed. Why did Charlene even need to practice? She knows the real hearings are just for show anyway. But you can imagine the earful I got from her. She's accused me of sabotaging the whole bill. I'm sorry, sir. I should have looked over his materials first, and we both should have. Well, Charlene is the one who insisted on practicing in chambers so it could feel more real. And then to find out it was recorded, and who knows how many legislators got to play back the whole thing before I had it deleted. At least no one else will be able to see it. So what's the plan now? Did Senator Emerson have any bright ideas? She thinks we'll just have to ignore all the medical reasoning, stay away from vaccine and disease data as much as we can, and simply push the idea that vaccines are good, diseases are bad. The 4 bloody pillars. Only we'll scale it back down to 3. Herd immunity, the danger of unvaccinated children, which we can still sell despite that hogwash Emilio spouted, and that vaccines are safe and effective. She thinks we stay away from any discussions on the CDC schedule and just talk vaccines in general and all the good they've done in the past, and steer clear of claiming a rise in disease, although we can shift it a bit to include the risk of diseases worldwide. Use statistics from other countries where children do die from these infections. But no more debates, no more public discussions, just focus on the good of vaccines. She thinks that if we just play it as a yes vote is a vote for vaccines and children's health, then we'll get it done. But how are we going to convince other legislators to go along with this now, especially if a copy of the practice session leaks out to the public? Elena asked. Well, it'll cost the pharmaceutical donor foundations a lot more money. They'll have to pitch in to a number of campaign funds for next year, but we should be able to get enough votes and to get enough senators who won't be bought to pass the law simply because vaccines are good. And it won't hurt us at all to have pharma spread their money around to more people besides Charlene and me. We already get enough bad press for being the largest recipients of pharma donations every year. So let's get to it. We have children to save. And call Jackson Jones. See if he has any ideas for damage control. That's right, Mr. Jones, Elena remembered. She'd forgotten to call him back amid all the chaos. Well, he's not going to be happy about this, but he'll know what to do. That was some crazy stuff you threw at the senator today, said Terry loudly over the din of the lively bar crowd. The whole thing has already been deleted off the hard drive. I checked. They must have gotten someone on that right away, but it already had over 3,000 views. Funny thing is, a lot of it sounded real, like you really believed it. You really had me going there. It was true, Terry, every word of it, countered Emilio, pocketing the flash drive that Terry had just handed him and leaning in more closely so he didn't have to raise his voice. I've been studying this issue for a very long time, gathering data and information, knowing that this would eventually come up as a political fight. When I got hired on by a Republican, I assumed I'd be helping my senator fight a bill like this. I didn't know how much pharma money Corson had received, though. Believe me, I almost quit when he first came on board with Emerson on this. But then they asked me to play devil's advocate, and I couldn't walk away. I didn't plan to have it go down this way in a live practice session, but they asked me to challenge them with what I knew, and I did. And as for what I said in there, it's all true. Trust me on this, Terry. I know what I'm talking about. But I always figured vaccines were so good. Well, I'm not saying they aren't good. That was one of the points in my speech. What I was saying was a mandatory law isn't needed, and it won't really work to lower disease. And what I said about the lack of safety proof in our full schedule, that was absolutely true, every word of it. And what I didn't really go into was exactly what the vaccine risks can be. That's an even scarier story. And it gets complicated, so I wasn't sure if it would be useful to throw in too much information into that setting. I was fine after all my shots, though. My sister Samantha, too. Yeah, me too, said Emilio. But you know who wasn't fine? My little brother. He got all the same shots I did, but the night that he got several shots together when he was around 1 year old, he started screaming and convulsing. We rushed him to the ER. His seizure went on for hours. They couldn't get it to stop. When it finally did, he was brain damaged. They call it encephalopathy. He never walked or talked again. Before that, he was a babbling, talking, happy little toddler, running around tearing up the house just like I did. Now he's a 28-year-old in a wheelchair who might smile at you on a good day. It broke my parents' hearts. Dude, did you guys sue or something? Emilio raised his eyebrows at his new friend. Seriously? You don't know? Terry, you can't sue doctors or vaccine makers for injury. Not in the United States, anyway. You have to go through a government vaccine court. We did that, and we won. They awarded my parents over $3 million for the injury. $3 million? Wow, that's a lot of money. But I guess it goes without saying you would much rather have your little brother back, huh? Damn right. The money helped us take care of him. But I added up all our bills and hardships over the years, and you know what? We've spent most of that taking care of him up to this point. What are we going to do when he has to go into an institution or something? My parents will never be able to afford that. And we were lucky to even win our case. Most people lose. It's a totally screwed up system. And you know who pays for it? We do. The Injury Compensation Fund is generated by a surcharge on every single vaccine. So it's government-controlled money, but it's not government money. It's the people's money. The vaccine makers don't have to pay anything. But that isn't really the worst part. What really made my parents angry was the denial from all the doctors. Every single one of them, without exception. From the doctors in the ER that very first night to the doctors testifying against our case in the vaccine court hearing, all said that the vaccines couldn't have done that to my little bro. They said it was all coincidence, that it would have happened anyway. All except the actual vaccine manufacturers themselves, that is. They have warnings about brain-injuring reactions and much more right there in the fine print that they send out with every vaccine package. So does the CDC. They even tell you to report any severe injuries like this to the government, a program called VAERS, Vaccine Adverse Events Reporting System, and to apply to the government's injury court called the VICP, Vaccine Injury Compensation Program, if you are injured. It's right there in the paper that's wrapped around the vaccine vials in every doctor's office. Seems like the only people that know about these risks are the people who make the vaccines and the small percentage who are injured. Everybody in between, from the doctors to the patients to the parents and the entire public, is totally clueless. Ha! And you know what else the vaccine paperwork says? It tells doctors to warn patients about these severe reactions before administering the vaccines, and to make sure they haven't had a prior severe reaction before you give any more vaccines. But our doctor tried to talk my mom into giving Arturo vaccines again when he was 18 months old, and again at 5 years. By then, my mom knew better, of course. You should have told that story in the hearing today. Nope. No one ever believes it. They just don't believe it. Even though the government has paid out over $3 billion to over 3,000 families, no one ever thinks it will happen to their own child. And they don't believe it really happened to yours. Vaccine injury victims are some of the most invisible people in our society. They're a reminder of what can happen, so everyone ignores them. They are too scary to think about, and their families, their voices are ignored as well. If I speak out as a family member of a vaccine-injured child, I get ignored. If I speak out as anything else, a doctor, a lawyer, a government worker, anything besides a victim, then people listen. And at least your family got compensated, right? I mean, that's better than losing your day in court, right? Asked Terry, generally interested now. What if they didn't even have that compensation program? You guys would have been financially devastated, right? On the surface, you would think so, but those of us in this fight see it differently. Back in the 1960s and 70s and even the 80s, many people were injured by vaccines, and some of them started suing the vaccine manufacturers, and they won large settlements, just like with any other pharmaceutical product that can cause harm. There were so many severe injuries that vaccine makers told the government, we can't keep making vaccines anymore because we can't afford the lawsuits. Usually when pharma makes a drug that starts killing or maiming people, it gets taken off the market, right? But nobody wanted vaccines to go away, so the government had to figure out a way to keep vaccines going without vaccine makers having to cover the cost of the occasional severe reaction. Meanwhile, victims of vaccine injury had gotten together and asked the government to set up the Vaccine Injury Compensation Program so that future victims could be more easily compensated without having to go through expensive and prolonged legal battles. But what nobody saw coming was that Congress decided to blend the two ideas into one. The 1986 Vaccine Injury Compensation Act set up the program we have today, but they also gave pharmaceutical companies immunity from being sued for vaccine injury. None of the injured activists knew Congress was doing that until it was too late. Terry jumped in. Let me ask you, Emilio, as someone looking at this from the outside, that seems like a good idea. It allows them to keep making these much-needed vaccines and lets some injured people get compensated. Yeah, it doesn't sound perfect, but it's something, right? I get what you're saying, Terry. Most non-victims will look at it that way. But here's the catch. If no one is liable for severe vaccine reactions, then there's no incentive to try to make them safer. And there's no incentive to carefully investigate why some vaccines cause more reactions than others, and why some kids suffer severe reactions and most don't. No financial incentive, that is. Sure, there should be a humanitarian incentive to make vaccines safer, to try to make vaccines that injure nobody, but I'm sorry to say, when it comes to private enterprise and pharmaceutical companies, it's more about money than humanity. I'm not saying that's wrong either. Pharma has every right to make every dollar for their shareholders that they can. But if you are a pharmaceutical company that gets to make tens of billions of dollars every year on your products without any risk, and all the doctors and patients that keep using your products actually believe there is no risk, and the government provides you with a law that guarantees you no risk, and the victims of your product get paid off by the public's money, not yours, what are you going to do? Just keep providing the same products, or devote billions of your own personal dollars to investigating why your products do occasionally hurt somebody and figuring out a way to make them safer? So far, no pharmaceutical company is yet to sign up for the humanitarian option. They do keep making new vaccines, but using the same techniques and ingredients they always have, with the same rare but serious reactions that continue to harm a minority of kids each and every day. And they aren't doing enough to try to fix the older vaccines. And as if that wasn't bad enough, some of the doctors and researchers who work for the FDA and the CDC who approve these vaccines have stock in the pharmaceutical companies that make the vaccines, including an ex-head of the CDC, according to a story put out by Financial Magazine. So do you think they and all the other stockholders want their companies to spend billions in safety research when they don't have to? So most people who are in this fight to prevent mandatory vaccine laws are also trying to repeal the 1986 Vaccine Injury Compensation Act so that pharma becomes liable again. That would force them to start making safer vaccines, and it would force doctors to start being more careful when they have patients who do have bad reactions. And there are so many vaccines today and so many opportunities to make newer ones that pharmaceutical companies are not just going to stop making them, like they threatened to do decades ago when there were only a few. They keep making them, but this would force them to do something about the vaccines with the worst reactions, even if it meant stopping production on one or two, or changing how many they give and when they give them. It would make the whole system safer for everybody. And today, in a modern country like ours, no vaccine is so critically important that it's worth continuing if it causes a lot of harm and could be made in a safer way. That's a lot of heavy stuff to process, amigo, offered Terry. But I get it now. You make a lot of sense. So what are you going to do now? I mean, job-wise. I thought I'd be screwed, but I've already gotten 3 offers from Republican offices who don't take pharma money, or who don't take much pharma money, that is, who naturally oppose most mandatory medical laws, who believe in the general principle that less government is better government, and who want to bring me on. Richardson's office even offered me the chief position. Would you believe that? So I'm good. But let me ask you, Terry, do you have kids? Are you married? Have you ever thought about all this stuff before? Nope, single. But hey, my sister has a baby. She and her husband just moved away from here. I wonder what she thinks about all this. How old is her baby? Just about to turn 9 months old. Why? You better call her, Terry. Call her right now and let her know she needs to do some reading before her next doctor's appointment. Those 1-year shots are what did my brother in. I'm not saying don't vaccinate. I'm just saying she needs to know the risks. Emilio signaled the bartender for another round as his new friend stepped away to find a quiet place to make the phone call. I got your back, little brother, he mused into his empty bottle. Wish I could have had it 28 years ago, bro, but I have it now. Resources for all studies in this chapter are available at johnphilipryan.com.